In 2021, the three leading causes of death were heart disease, cancer, and COVID-19. In 2021, the three leading causes of death were heart disease, cancer, and COVID-19. That decrease follows an already big decline of 1.8 years in 2020. As a result, the expected lifespan of someone born in the US is now 76.4 years, the shortest it has been in nearly 2 decades. The two reports, released by the CDC on Thursday, showed deaths from COVID-19 and drug overdoses, most notably synthetic opioids like fentanyl, were the primary drivers of the drop in life expectancy. It's not a good year for the data, let's put it that way, says CDC statistician Kenneth Kohanek. It's rare to see such big changes in lifespan year to year, but the pandemic claimed nearly 417,000 lives last year, more than even the year before, making COVID-19 the third leading cause of death for the second consecutive year. Kohanek and his colleagues had hoped the release of new vaccines might make for a healthier 2021, and didn't anticipate deaths from COVID-19 would top the prior year. But they were wrong. In fact, COVID-19 accounted for about 60% of the decline in life expectancy. Preliminary data from 2022 so far indicate deaths from COVID-19 are on the decline. But Kohanek says that doesn't mean life expectancy will rebound quickly in years to come, because COVID-19 was, by no means, the only contributor to the higher death toll in 2021. Heart disease, the leading cause of death in the US, along with other top killers like cancer, diabetes, and kidney disease, also proved more lethal in 2021. Meanwhile, deaths from Alzheimer's, flu, and pneumonia declined, perhaps because the coronavirus hit the elderly population particularly hard. The new numbers also speak to the acute mental health crisis that's run parallel to the pandemic. Deaths from drug overdoses reached over 106,000 last year, another major factor reducing life expectancy, according to the second CDC analysis released on Thursday. Deaths by suicide and from liver disease, or cirrhosis, caused by alcohol also increased, shortening the average American lifespan. The majority of those deaths are to younger people, and deaths to younger people affect the overall life expectancy more than deaths to the elderly, Kohanek says. Men and women saw a similar decline in life expectancy last year. But women are living, on average, until over 79 years old, which is about 6 years longer than men. The CDC also found that death rates for certain racial and ethnic groups actually decreased last year, specifically among Hispanic and Black men. Death rates increased for almost all other groups, although it was most pronounced among white men and women, as well as American Indian or Alaska Native women.
India on alert for new variants as COVID wave sweeps China. India's health minister has advised the public to take precautions against COVID-19, including getting vaccinated and wearing masks, as the country remains on alert for potential new variants that could emerge from the wave of infections sweeping neighboring China. Health Minister Mansukh Mandavia on Thursday told Parliament that India would begin randomly testing 2% of international travelers arriving at the country's airports, after he asked regional authorities to send positive samples to laboratories monitoring for new COVID strains. States have been told to make people aware of wear masks, use hand sanitizers, maintain respiratory hygiene and social distancing, Mandavia said, as he encouraged Indians to receive vaccines or booster shots. Speaking Wednesday at a meeting to review the COVID situation in the country amid rising cases in several Asian nations, Mandavia said, "COVID is not over yet. I have directed all concerned to be on the alert and strengthen surveillance." India, a country of 1.3 billion, relaxed its COVID restrictions earlier this year after a drop in infections, and people have mostly stopped wearing masks outside. The warnings from the Indian minister come as China braces for infections to spread from its biggest cities to its vast rural areas following its hurried and underprepared exit from the zero-COVID strategy earlier this month. On Wednesday, World Health Organization chief Tedros Adhanom Ghebreyesus expressed concern over rising cases in China, emphasizing he was worried about increasing reports of severe disease. In order to make a comprehensive risk assessment of the situation on the ground, WHO needs more detailed information on disease severity, hospital admissions and requirements for ICU support, Tedros told a news conference. The surge could lead to nearly 1 million deaths in China, according to a study released last week, which added it was also likely to overload many local health systems in the country. Meanwhile, Chinese experts have warned that the worst may be yet to come. Wu Zunyu, chief epidemiologist at the Chinese Center for Disease Control and Prevention, said last week that China is being hit by the first of 3 expected waves of infections this winter. Last year, India was devastated by a second wave of COVID-19, which killed tens of thousands and overwhelmed the country's health system. Since then, India has administered more than 2 billion COVID vaccines and nearly 75% of its population has received at least one dose, according to data from Johns Hopkins University. According to the Health Ministry, India had seen a steady decline in cases, with an average of about 150 infections a day nationwide as of December 19. "We are prepared to manage any situation," Health Minister Mandavia said in a Twitter post Wednesday.
Five things to know before the stock market opens Thursday. Maybe Santa is going to deliver for the stock market, after all. There are still 2 trading days left till Christmas, and Wednesday showed stocks still have rallies in them, even during this otherwise sluggish month. The major indices surged, with the Dow jumping more than 500 points, and the S&P rising 1.49% and the Nasdaq posting a 1.54% gain. Still, stocks are on course to finish December in the red and potentially end up finishing their worst yearly performance in 14 years. On Thursday, investors will chew over the latest jobless data claims. Semiconductor maker Micron, squeezed by declining demand for personal computers, said it would reduce its workforce by about 10%, while also suspending bonuses. That amounts to a few thousand staffers, as a recent filing showed the company had about 48,000 employees. Micron announced the decision as it posted its latest quarterly results and forward guidance, both of which fell below Wall Street's expectations. In the last several months, we have seen a dramatic drop in demand, CEO Sanjay Mehrotra said in prepared remarks. If you've been following the collapse of crypto exchange FTX and the prosecution of its founder and mastermind, Sam Bankman-Fried, you've probably been wondering why we haven't heard from Gary Wang and Caroline Ellison. And if you suspected they were cooperating with the feds, you were right. On Wednesday night, federal prosecutors revealed that Wang, a co-founder of FTX, and Ellison, who was co-CEO of sister firm Alameda Research, had agreed to plead guilty to federal crimes while working with authorities on the case of the fallen crypto firm. The news broke while Bankman-Fried, aka SBF, was on a flight from the Bahamas to the United States to face his own prosecution. Ukrainian President Volodymyr Zelensky took Washington by storm Wednesday in what's been hailed as a triumphant visit. It was his first known excursion beyond Ukraine's borders since Russia launched its unprovoked invasion on the former Soviet country in February. Zelensky's trip to the U.S. Capitol included a meeting and a press conference with President Joe Biden at the White House and a rousing, 32-minute address to a joint session of Congress. Thank you for both financial packages you have already provided us with and the ones you may be willing to decide on, he told lawmakers, who are set to approve more than $44 billion in new aid for Ukraine. Your money is not charity. It is an investment in global security and democracy, that we handle in the most responsible way. Home sales tumbled a deeper than expected 7.7% in November from October, marking the 10th consecutive month of sales declines. The sales reflect contracts signed in September and October, when interest rates had peaked before coming down a bit in recent weeks. In essence, the residential real estate market was frozen in November, resembling the sales activity seen during the COVID-19 economic lockdowns in 2020, said Lawrence Yun, the chief economist for the National Association of Realtors.